Good day, everyone. So today we're going to do week one, the introduction to the course, the philosophy of the human science curriculum, the universal principles of human science curriculum, humanism, feminism, phenomenology, and the critical social theory. So the first question here is, what is phenomenology? So phenomenology is the study of human experience and the way things present themselves to us through experience. It is the study of structures of consciousness as experienced from the first point of view, so from your point of view. So there is a theorist called Husserl, who considered the founder of the phenomenology movement, who accepted these kind of characteristics. He focused on consciousness and thought of phenomenology as a kind of descriptive enterprise that would specify the structures that characterize consciousness and the world as we experience it. The first point of view means the phenomenologist, the investigator, has to investigate the consciousness, studies his or her own experience from the point of view of living through that experience. So it's important to take this on because it's acknowledging your own consciousness and your thought. Then we have the critical social theory, which is a theory that's oriented toward critiquing and changing society as a whole. It's different from traditional theory where it focuses on only understanding or explaining the society. The theories aim to dig beneath the surface of social life and uncover the assumptions that keep human beings from a full and true understanding of how the world works. So the critical theory, as it's known today, can be traced back to Marx's critiques of the economy and society. It's inspired greatly by Marx's theoretical formulation of the relationship between economic base and the ideological superstructure that focuses on power and domination, how society operates. The other theory is the feminist theory. So feminism is defined as a world outlook that standards women and that confront methodological injustices based on gender. It provides a way of examining women from the context of their own familiarity, and it's not only feminism influences women that is paramount, but women influence on feminism. It is the women's experience and vision, women's knowledge and ways of knowing that has formed feminism, and this identical knowledge is utilized by many nurses because most of us are women to form the theory that leverage performs. The woman's worldview is influenced by her history and differences such as social class and ethnicity, sexual orientation, and economical and political factors that affect her values, beliefs, and experiences. And these inherent dissimilarities between women, which leverage their knowledge and their conceiving, are also to be addressed by feminism. And finally, humanism. So humanism is a democratic and ethical life stance that affirms that human beings have the right and responsibility to give meaning and shape to their own lives. So as nurses, how do we focus on that? So the humanistic model of nursing looks at the patient as an individual and that each situation is unique. So you'll see that in your PowerPoints that I have not added what these theories are. That's important because sometimes it's nice for us to read up more on it. And it's not something that will be quizzed on your midterm, where I want you to focus a lot of your attention. So there may be these definitions, so it's important to know what they are, but they won't be a large focus of the exam. In this chapter, or in this section, I asked for chapter 1 and chapter 11. So I'll give you a brief history of early nursing to appreciate the future. So nursing was first viewed as healing and helping vocation in Canada. The role and character of the Victorian women was to be competent and have a slight knowledge of anatomy, physiology, and surgery was necessary, with a delicate sense of touch combined with gentleness. In the earliest stages of nursing, it was required that one be Christian. A good home, basic education, and solid Christian character were requisites for entering the profession. Florence Nightingale is considered the founder of modern-day nursing. She precipitated an evolution in the education and practice of nursing. Unfortunately, she did not believe there was a place for men in the nursing profession. Fortunately, we've been slowly adding more men into the nursing profession, and as of 2016, nearly 8% of RNs are male. So nursing education, the first nursing school was established here in Canada, and it was in St. Catharines Training School in 1874 at the Marine Hospital. The admission standards were plain English was important, good character, and Christian motives. The schools of nursing in Toronto General opened up in 1881, followed by several other schools started to open. There are many licensing programs across Canada, including the licensed practical nurse or registered practical nurses, university-based nursing education, collaborative nursing programs, the BIEN refresher programs, the baccalaureate nursing degree, graduate nursing degree, and advanced practice nursing. So there's a little bit of an art with nursing. So there's 4 fundamental ways of knowing by Carper, they were developed to formally express nursing knowledge and provide a professional and discipline identity. The 4 fundamental patterns include empiric, ethical, personal, and aesthetic ways of knowing in order to get emancipatory. So empirical knowledge is the factual knowledge from science. Personal knowing is concerned with becoming self-aware, personal reflection, openness to experience. So as you'll grow through this program in this class, you'll see there's a lot of reflection, and the College of Nurses require you to personally reflect and how you will learn from a situation. Ethical knowing is the core of nursing practice. It guides and directs how nurses conduct their practice. It focuses on what matters of obligation, what is ought to be done, right and wrong, and the ethical codes of nursing from the Canadian Nursing Association. So the Canada Nursing Association sets out the Code of Ethics for registered nurses. I suggest you read that document. It is the core of nursing for our Code of Ethics. And then followed by that is the aesthetics of nursing, so the awareness of caring in the moment. Emancipatory knowing is addressing the barriers of social and political problems of injustice and identifying ways to change. So as nurses, we are change agents, and that is an expectation. It doesn't happen overnight, but eventually that is what the role of the registered nurses is, to inquire change. So some basic concepts that are important to know. So nursing theory and theories used in nursing. So what is a concept? So concepts are an idea or notion that represents some aspect or personal human experience. We use concepts to understand or describe situations and circumstances. So what is a theory? Well, theory comprises of several concepts used to describe, explain, and make predictions about a phenomenon. So it helps us organize our knowledge and make sense of ideas, promote discoveries, and advance your nursing practice. So these two are not linear. So you can start practicing in your workplace and you'll see, oh, that doesn't really make sense. So then you go back to the theory. So just some personal examples. In my professional practice, you'll see something done in the beginning of your career. So 10 years ago, how we inserted Foley catheters is much different than how we do it now. So before, the practice was you would inflate the balloon when you're inserting the catheter prior to, and then deflate it. Now the recommendations are you don't need to do that. So a lot of things in practice can be changed as long as the foundation of theory is correct and maintained. And research, it's important to know that the information that we have today can change tomorrow. So a lot of our research practices are based on the information and the tools that we have right now. So one of the expectations as a registered nurse or a registered practical nurse is you're always staying updated with the current literature, because the literature does change. Information and tools change around us, and it's important that we become adaptable. And then our education changes. So you'll see in the textbook there is 2 little circles, one that says theory, one that says practice, research, education, administration. So it's not linear. That relationship is never linear. It's not black and white. It is in a circle. So things change, education changes, theory can change based on the research, the practice, the education, and the administration. So using the meta-paradigm framework, so the concepts of nursing, person, health, and environment help shape the guiding principles of nursing practice. So you'll see in the nursing paradigm, there's nursing, the person, the environment, and health. So the nursing theories are specific to nursing because they address relationships among the key concepts that make up the paradigm of nursing. So what is the nursing paradigm? Well, a paradigm is a model. It describes the domain using science, philosophy, and theory. So nursing paradigms involves the person, health, environment, and nursing. So what is the environment? Well, the environment is the setting affecting the client or the patient and a community. What is nursing care? Well, treatment of human responses to illness. So that is a lot of what nursing can be. It's certainly not everything. So what is health? Well, as you've learned with the definition of health, so health is dynamic, it's changing based on the individual and what the person says it is. And what is a person? Well, it's the recipient of care. It can be an individual, it can be a family, and it can be community. So through this paradigm in our worldview, it serves as the philosophical underpinning for explaining any phenomenon on interest for the discipline. So it determines the goals and boundaries of a discipline and organizes the knowledge. They're an abstract way of articulating the knowledge about a specific philosophical and changeable situation. So it explains the nature of human beings, their relationship with the environment, and the human universal health processes. So the nursing philosophers, based on their philosophies, offered various paradigms that contribute to the development of the nursing knowledge. In the next video, we will go over the CNO Learning webcast and critical inquiry and evidence-informed practice. So stay tuned.